Thank you, Dean Delaney. Hello, everyone. It's truly an honor to address the graduates of the University of Minnesota School of Nursing. And I join you in acknowledging that we stand within the traditional homelands of the Dakota people and honor the peoples on whose land we live, learn, and work. So it's finally here, graduation day. Wow, you all made it. Congratulations. It is my pleasure to congratulate the Bachelor of Science in Nursing, Doctor of Nursing Practice, Doctor of Philosophy in Nursing, and the Institute of Health Informatics Programs graduates on your achievements. I also want to recognize the family and friends who have undoubtedly been supporting you throughout your education, as well as the stellar faculty and staff of the school. Now, this ceremony symbolizes your journey and success. As graduates, you are caregivers, leaders of change, advocates, innovators, champions of evidence-based practice, and nurse scientists who are asking and answering the most pressing healthcare questions of our time. You will generate improvements in practice, challenge the status quo, advocate for policies that achieve health equity by dismantling systems that uphold disparities and replace them with equitable, compassionate, and inclusive care. That is the work before you and before us all. We have great expectations of you to drive progress on the front lines of change, from the community to boardrooms, from classrooms and labs to the C-suites and into our legislative chambers. Whether you started your program 2, 3, 4, or more years ago, your lives were forever changed by the COVID-19 pandemic. Now, you knew that was going to come up today, right? And let us all hope that this has been a once-in-a-lifetime experience for us all. So obviously, nursing is serious business. Why else would we all dress up with these storied caps, gowns, and mortarboards if we weren't serious, right? Actually, we are here to seriously celebrate all of you. Looking back over the past few years, many of you have withstood great fear, fatigue, and traumatic stress while bringing hope and healing to patients and colleagues. No one was left untouched by the devastation of COVID. We all lost friends, family members, colleagues, and patients. You and all our healthcare colleagues have been emotionally tied to the daily trials confronting us from this virus, but you've also shown the world the value of nurses. And now you have incredible careers ahead of you, made stronger because of what you've experienced. This is a really great time to be a nurse. Actually, it's always been a great time to be a nurse. But now we are poised to accelerate changes that will have lasting effects on our profession and our capacity to heal the world, which is suffering from diseases, poverty, discrimination, war, political divisiveness, mental health challenges, disregard for our planet, and unrestrained violence. All these maladies and human suffering connect to health. Left unaddressed, any one of these crises become health crises. Look no further than the headlines about climate change, gun violence, gender discrimination, or destruction of hospitals in conflict and war zones. Each has devastating effects on health and mortality. But this is also a time of great hope. You are earning your degrees in a moment when the world has recognized that we cannot have health or health care without nurses and our informatics partners. You are looked to and listened to like never before, and will be called upon to shape healthcare into the future. So it's really up to all of us to seize the moment and be seen and heard. Just 3 days ago, on May 12th, we celebrated International Nurses Day, which commemorates Florence Nightingale's birthday. The theme for this year's day, established by the International Council of Nurses, is Our Nurses, Our Future. The ICN issued a charter for change, which calls on the world to value, protect, respect, and invest in nurses for a sustainable future, not just for nursing, but for healthcare. It presents 10 policy actions that governments and employers must take to create and sustain healthcare systems that are safe, affordable, accessible, and responsive, and shift nurses from being invisible to invaluable. The charter and theme for this year's International Nurses Day are not just for one day, but they're a roadmap for our preferred future, with nurses leading change. We have the smarts and the education, and now we need to be sure that we have the political will and courage to lead. In the US, we are 4 million strong, and as you heard Connie mention, worldwide, 28 million strong. But we're rarely in the right spotlight, and there are not enough of us. Globally, there's a shortage of at least 7 million nurses right now, half of which are in our African countries. But even so, we can make change. Nurses have always taken on the challenges of today and tomorrow to change the world for the better, with an indelible impact on people's lives. I've recently had the opportunity to hear about the progress that nurses have been making across the globe in countries like Costa Rica, the United Arab Emirates, Botswana, Turkey, Japan, and Ukraine, despite the crippling effects of workforce shortages, natural disasters, and the ravages of war. Nurses are accustomed to dealing with adversity, and we've always protected and advocated for those we serve. This is a time that calls on all of us to speak for those without a voice and help restore justice, equity, and care for all human beings. On a global scale, nurses are tackling the effects of climate change, the social and economic forces that result in premature death, the conditions that rob people of quality of life, ensuring path to a peaceful end of life, and many other aspects of healthcare that are at the intersection of health and human caring. There are hundreds of stories of innovation and life-changing interventions spearheaded by nurses. There are also thousands upon thousands of exemplars of courage, caring, daring, and comfort expressed in the Daisy Awards in the US and around the world. And the world needs to learn more about the incredible acts of nurses. One of the things that makes nursing unique is that we're a composite of stories that describe the human interactions exclusive to the intimate relationships we share with strangers, and the courageous acts that are humbly described as, oh, it was nothing, when in reality, you've made a life-changing difference for someone in their family. And stories that we keep to ourselves about the stress and challenges that we face that may be too painful to share, knowing we do what we do for the good of others or intellectual challenges. These stories also reflect a universal truth in nursing. We are very proud of what we do, and that pride sustains us in times of adversity and propels us to stay focused on fighting the good fight. As president of ICN, my watchword is influence. The voice of nurses needs to resonate in the highest places to shape the changes needed in healthcare, to heal the workforce, and secure greater investments to rebuild and protect nurses everywhere. And we can have hope because others are stepping up to help us now. Just last week, I had the privilege of addressing a high-level stakeholder hearing at the United Nations on the plans for pandemic prevention, preparedness, and response. My comments, delivered to a global audience, focused on improving the workforce conditions that have failed us by not valuing, respecting, or protecting nurses and other workers. I emphasized the global threat of workforce shortages, not only for pandemic preparedness, but also for expanding access to care through universal health coverage, emphasizing the need for investments in jobs, education, mental health and well-being, and elevating nurses to top leadership positions in government and healthcare organizations so that they, all of you, can strengthen health systems and influence policy decisions. Comments from the audience voiced support for nurses and my recommendations. It was gratifying to know others recognize the indispensable nature of nurses and our pivotal role in global health. Now that is power. I'm reminded of the work of Dr. Joanne Ashley, who was an influential and controversial nurse scholar, as well as a feminist activist who fought for social justice and urged control over our practice and resistance to domination by other disciplines, as well as oppressions that affected working conditions. In 1975, she implored the profession to challenge the status quo and to rise above the oppression of paternalistic systems with her words, and I quote, "We need to foster the creation of rebels in our midst, rebels who have insightful knowledge, vision, and a cause, rebels with the inner courage to fight for it openly. We need nurses who will fearlessly and repeatedly raise questions about their place in established institutions and in society." To create the future we want, we all need to be rebels. Ashley strongly advocated for political involvement of all nurses, calling for them to take part in the political life of their community and country. She emphasized that nursing practice as involvement in political action is inseparable from nursing practice in the clinical, research, or education environments. She believed the practice of nursing should reflect the public interest and its enhancement. She admonished colleagues, again I quote, "Constantly bemoaning our lack of power is not likely to result in either change or improved professional status." She pointed out that nursing has always had power, but cautioned that the problem was in the ways in which nurses have used, misused, or abused their power or failed to use it at all, and in the system in which nursing was developed and practiced. To be a rebel is to have power to make change. And we make, okay, I got some rebels down there, that's great. You're ready. And we make change by increasing our agency, which means having the ability to act with purpose. But that by itself is not enough. Change also requires courage, which is possessing the resources needed to act in the face of difficulty and uncertainty. The root of the word courage comes from the Latin cor, for heart, and we all know that nurses act with heart. I'm so proud of all of our colleagues who've shown undaunted courage and sacrifice throughout the pandemic on the front lines of public health and hospitals, and also in our nursing homes, schools, universities, and everywhere nurses have been called upon to help. I'm also aware of the sacrifices of nurses in Ukraine, sleeping in the basements of hospitals and risking their lives to care for others, or now in Khartoum, Sudan, where most hospitals have been destroyed and supplies are almost non-existent. They try to care for the sick and injured. And also, you may not be aware, nurses in Korea have been fighting for 3 years for a nursing act to define and protect the practice. Just last week, the leaders of the Korean Nurses Association went on a hunger strike, one of whom is in a hospital. And they're fighting desperately for the legislature that passed the law to get the signature of the president, which unfortunately will probably not happen today or this week. But these are some of the invisible acts of courage around the world that just signify the impact of nurses. These efforts showcase the essence of caring that has always been the hallmark of nursing professionals. Now, don't let anyone tell you that these are soft skills, but rather to care and act with compassion is physically and emotionally demanding work. Years into the future, when you visit with your fellow alums, you'll laugh together and reminisce about your time here. You'll recall the professors who inspired and challenged you or made life difficult, and everything in between. It's impossible not to reflect on the intense patient interactions, the aha moments, and the points of pride that defined your nursing education and experiences. Together, all of you in this awesome class of 2023 have much to celebrate. It is clear now, more than ever before, that nurses are true fighters, or perhaps you prefer the word advocates, for the rights of our patients, for the resources they need, and for the recognition that nurses are the key to health and healing. The Connor brothers, who draw iconic visuals, got it right in 2020 with their image of a nurse that was rather outdated. It was a white uniform and a cap. But in their statement, the poster says, there are no extraordinary people, just ordinary people doing extraordinary things. And they aptly described that nurse. Together, we can share hope for a future that builds on our shared pride and the power we possess to change the world. Congratulations as you take the next steps in your career and take up the mantle of rebel. Remember to have fun. We can't be too serious all the time. Exercise courage so you're never invisible, and be sure that those around you understand that you, as a nurse, are invaluable. I wish you all the best for success. Thank you.